Hi everybody, and welcome to our show. Our community is seeing many of the veterans who served in World War II and Korea pass away, and the number of deaths of the Vietnam veterans is beginning to rise. By recognizing the unique needs of veterans who are facing a life-limiting illness, the Denver Hospice Care Center is able to guide veterans and their families toward a more peaceful ending.
He joined the Navy first as a young man when he was right out of high school. After dating for several years, he proposed, and he decided before we got married that he would make the decision to go into the Air Force. So 9 days after we were married, he joined the United States Air Force and stayed there for the next 18 years. He retired honorably, went civilian.
Later, Jim was diagnosed with prostate cancer, which was being managed at home.
There were so many medications that he had to be on.
But there was an unfortunate accident that put him back in the hospital.
I heard this fall, and you know, it was serious. I didn't want to see him suffer any longer.
His family made the decision to place Jim at the Denver Hospice Care Center.
I knew that he was getting the care that he would want. Me being his spouse and his wife, you know, I could not have cared for him in the way that they cared for him, you know, in his last days. It's no way in the world. I appreciated everything that the Denver Hospice did for my husband.
Sherry can now look back on the time Jim spent at the Denver Hospice Care Center and know that her husband was treated with respect during his final days.
People loved him, you know, and at the service, people came from, you know, various churches to celebrate his life, and it was a blessing.
Maria Callis is the Denver Hospice Liaison to the Veterans Administration. Thank you so much for being here, Maria.
Thank you for inviting me, Christine.
I love this story, but you have many stories like this at your facility. Can you tell us a little bit about what you do?
Yes, about 6 years ago, we discovered that we were caring for more and more veterans, and we decided that we would develop a program for our veterans, and it started with admissions. What we did in admissions is every patient that was referred to us, our admission nurses and social workers would ask them, are you a veteran? Are you receiving veteran services?
And you treat these veterans very honorably, so the service that they provided, you know, in whichever war they served, you continue on in your care center.
We do. Our chaplains will meet with every veteran that comes to the Denver Hospice and share with them this certificate of appreciation. It's a way to honor our veterans and a way to say to them, thank you for your service. We appreciate it. And folks will just weep. We will see veterans who are just weeping when they get the certificate.
When I toured your facility, you even have a special wing for the veterans.
We do. The Bill Daniels Fund gave us some money so that we could have a veterans wing and a veterans lounge, and we are just so pleased to have that. Bill Daniels was a World War II pilot and has a special love for veterans, so we do have our wing. We have a lounge that has a wall of honor, and every veteran who comes to the Denver Hospice, we ask the family, can we have a photograph of your loved one when they were in the service?
Yeah, I saw that. That was absolutely beautiful. If people want more information about your care center or about the Denver Hospice, where should they go?
They can call us at 303-321-2828, or our website is thedenverhospice.org.
Maria, I can't thank you enough for what you do at the Denver Hospice, and I know it's a very rewarding job for you.
Thank you. We feel like it's really sacred work. Thank you, Christine.
Thank you very much. It's very apparent.